Hello, everyone. Dr. Dave Katz with my head assistant, Jennifer. We're not doing an infomercial here. We're not trying to just do a commercial and sell things. We want to show you all the different options that you have because there's always options. We get patients every day who come in, second opinions, right?
Right.
So here's the question, because she and I have disagreed on this. We are very transparent in the office. So, this is just how we operate. So let's say 10 patients come in, second opinion. They've been told that they need full mouth implants. Common thing, because with the big implant centers out there, we see all the people that go, wait a minute, I'm not sure I really want that. So what percentage would you say out of 10 actually need to have full mouth implants or full arch implants?
So probably 1 out of 10 patients.
Okay, so I'm kind of okay, we're close. I'm guessing 1 to 2. So that's 10 to 20%. Are we in the same ballpark?
I think so.
Cool. So the real question is, like, what are the actual choices? So if you come to us, we're going to give you choices. Okay, if you go to a lot of these places, they don't give you the choices. I guess that's kind of, to me, the big elephant in the room of dentistry right now, is that we see people coming to us and they have big old treatment plans, sort of like literally they're this thick, $20,000, $30,000, all that. And sometimes that's needed, but a lot of times that's not needed. Here are the 3 choices that we lay out for you guys. If you don't have any teeth at all, and so I'm trying to speak to each one of you, like some of you have no teeth and you have dentures, you're tighter dentures. Others of you have some teeth left or maybe a lot of teeth left, and you've been told, that you should have your teeth removed and have full arch implants. If you're in that category where you still have teeth left, that's 2 and 3 here: snap denture or permanent implant bridge all-on-4 zircon, which is kind of confusing. We're going to clear that up right now. So just to be real simple, obviously this person doesn't have any teeth, right? So their first option would be a denture. A lot of you are in dentures right now and are in this category. Okay. The second choice is what's called a snap denture. Should I clear up the all-on-4 thing? Like they're both all-on-4.
They're both
right?
all-on-4s. Okay. One permanent, one snap.
So I'd like to clarify this, because dentistry is I don't know if we've chosen to be confusing about this, but bottom line is there's 4 implants there. You can use the 4 implants to either snap a denture into. See inside there's little snaps like that. So I call them trailer hitches. And then on this side here, there's the trailer hitch on top of the implant. We bolt them in, and then you go like this. Can you hear the click? Okay. They click. Okay. But here's the thing. Let's say you want permanent teeth. We're going to show you an example of that in just a bit. You can take the same exact implants, 4 of them, and you can screw this on permanently. But notice that it's the same 4 implants. So I guess we could call the removable all-on-4 the snap denture, and this is the permanent bridge all-on-4. They're both all-on-4. All right. So I made this up, but if you take a look at what all of those things have in common, what do they have in common?
4 legs.
4 legs. And are 4 legs better than 2 legs?
Absolutely. More
Right.
stability.
More stability. So I hope that explains what all-on-4 is. All-on-4 means all the teeth on 4 implants. You can have 5 implants. You can have 6 implants. Up to 6 is about the max you really even need. More the better, up to 6. What are the benefits of all-on-4? And again, we're going to show you all the different options here, which is, full denture, the snap denture, the permanent denture, but we're also going to show you some other options. Let's say you're only missing 1 or 2 or 3 or 4 teeth, maybe one side. You don't need any of those options. You need something else. But back to the benefit of the all-on-4, obviously stability, very, very solid. Yeah, you put this on 4 implants and nothing's moving. It's as close as you can get to your natural teeth. A lot of people ask the question, how solid is an all-on-4 snap denture? Pretty solid.
Still solid, for sure.
Do you remember what Sally, our patient, said the other day? Were you there in the room?
No, I wasn't.
Even sometimes I don't wear, obviously snap denture. And I had a new patient in one room ask, how solid is can you chew corn on the cob? That was a question, or bite an apple. And Sally came in and said, I didn't know what she was going to say. And she said, yeah, you can. You can chew, you can bite off
And she
an
has a
apple.
snap.
And she had a snap,
Yes.
yeah, on the top.
Hmm.
Cool. So they're very, very stable. Obviously, things are going to last longer, particularly with this one, because it's made out of a really hard material like porcelain, only stronger. And that immediate results thing up there, that means you can do teeth in a day, because the more implants that are there to
Well,
hold. What's
If
that?
you have enough bone, of course.
Well,
If we're getting technical.
well, thank you for that enlightenment there. So, as my assistant was just saying, if you have enough bone. Okay, thank you for
Mhm.
that reminder.
You're welcome.
And well, what percentage of people have enough bone to do immediate teeth in a day?
Probably, I'd say like 75%, maybe. Most
I
people.
agree. It's
Most people.
most people have enough bone. Every once in a while, you have to, they don't, and you have to do bone grafting and all that. What's the number one thing we know about every patient that comes to us?
The patient knows.
Really?
Yeah. Shocking, right?
It is shocking. So, if you come to our office, we have a very unusual philosophy, which is we think you guys out there have a good gut feeling for what you need,
Mhm.
and we don't try to talk over you or tell you no, this is. I mean, people have a good idea
Yeah.
of what they want. You know, we trust you guys. What we're seeing out in the profession,
Mhm.
we see so many people that are told they need implants, they don't.
Right.
And then again, a lot of people do need implants. And the question, most people who come to us, and I'm assuming that's the question for you all out there, is, do I really need implants?
Mhm.
And if I do, how many? And if I don't want implants, what are my other options? If you go to an implant center, again, the elephant in the room, these are large corporations. You're going to be told you need implants most of the time, to be honest with you. I think you all know that. And that's why people come to us and say, all right, I need other solutions, or at least I need to be aware of my options.